Ganito kami magluto at mag-prepare ng itlog sa aming bahay. So it's all eggs just with salt and pepper. At alam nyo ba ano ang kasabay naming pagkain ng itlog? Others will eat rice or bread or other vegetables. But for us, we eat it together with pork. So ito ay pinakuluang pork, adobo, without soy sauce, without sugar. So just pure salt, pepper, and vinegar. So yan, mataba, di ba? This is also how we eat pork. Yung ratio ng taba at saka ng laman ay equal lamang. We don't avoid fats. Hindi kami umiiwas sa taba, pero alam nyo ba kung ano yung iniwasan namin? Carbohydrates, kanin. Yes, hindi kami kumakain ng kanin, and that is what is in our table. So yan, that's egg, and then the pork, and then the chicken feet. Tapos, yung aming beloved neighbor nagbigay ng German franks with cheese. But what we prepared only are this, adobong Adidas, and then eggs, plus ito yung mga spices, kung ano-anong spices lang. So these spices will just make the food looks and taste not so ordinary. Para pang pasarap without the added carbs. So bakit walang kanin? Because when we avoid kanin, when we avoid rice, when we avoid carbohydrates, we are also avoiding heart attack, yung cardiovascular diseases, heart attack, stroke, yung pagkakaroon ng atherosclerosis, and associated na mga problems in the blood vessels like yung problem sa kidney, yung pagkakaroon ng CKD galing sa hypertensive nephropathy o yung pagkasira ng kidney dahil sa pagtaas ng blood pressure, and also diabetic nephropathy, pagtaas naman ng blood sugar na nakakasira din sa mga microvascular elements ng ating kidneys. So when we limit rice, when we limit carbohydrates, we are also limiting the incidence of heart attack. I know mahirap paniwalaan because for the longest time, yung sinasabi sa atin is iwasan yung taba. Umiwas sa taba upang hindi magkaroon ng sakit sa puso. Pero lahat tayo, marami nang kilalang namatay na umiiwas sa taba for the longest time in their lives, and yet they still succumb to heart attacks, to stroke. Yung kanilang blood lipid level is within normal limits, umiinom ng statins, hindi na kumakain ng taba, hindi na kumakain ng itlog, nililimit yung itlog to 1 egg per week, hindi na o kumakain ng mga fried foods, lahat tinola, lahat sinabawan, lahat grilled, avoiding fats altogether. And yet, ano yung nangyari? They are still being hospitalized because of cardiovascular disease. Hindi ba kayo nagwa-wonder kung marami tayong kilalang mga health conscious na hindi kumakain ng karne, hindi kumakain ng baboy, umiiwas sa chicharon, puro prutas lamang yung kinakain, panay kain ng tinapay, kanin, pero walang meat. And when they get their lab results, nakikita merong either elements of fatty liver disease, merong elevation ng mga liver enzymes, o pagtaas ng kanilang triglycerides or VLDL. Kahit pa yung LDL nila ay mababa, meron ding iba na yung kanilang blood sugar control ay tumataas din. And this is of no surprise now. Noong unang panahon, sinasabi na yung pagkain ng taba yung nakakasama. But that is already a thing of the past because in 2019, ang Diabetic Association of America, American Diabetes Association or ADA, already published the 9 types of diet na nakita nilang nakakatulong sa pag-control ng blood sugar ng mga diabetics. At kapag na-control yung kanilang blood sugar, naging normal yung kanilang HbA1c o yung laboratory test to check the 3 months control ng isang blood sugar ng isang tao, and resulted into weight reduction, yung kanilang mortality ay also bumababa din. So that is how important yung ating adhere sa low-carb way of life. And just recently, 3 days ago, 4 days ago, it's already March 4, yung AHA naman, American Heart Association, also published in support. Ang title ng scientific statement na to is Comprehensive Management of Cardiovascular Risk Factors for Adults with Type 2 Diabetes, a scientific statement from American Heart Association. So they discussed here ang importance ng pag-control ng blood glucose sa isang taong may diabetes upang yung overall outcome niya ay mag-lessen din yung risk niya for heart attacks, because the number one killer of diabetic people, the number one killer ng mga taong merong diabetes is actually not directly related to elevated blood sugar, hindi hyperglycemia, but it's the secondary effect ng hyperglycemia, which is the heart diseases, heart attack, pagkakaroon ng cardiovascular diseases. And the missing link between hyperglycemia and heart attack is actually the elevation of insulin. Elevated blood sugar will spike elevated in insulin, and most especially sa mga diabetic na insulin dependent, na instead of lowering their need for insulin by taking in lower blood sugar, lowering their blood glucose by lowering their carbohydrate intake, they will also lower their need for insulin, because too much insulin makakalid ito ng pamamaga sa loob ng katawan. What I'm saying is, instead of magdepend tayo sa pag-inject lamang ng insulin o pagpapataas ng insulin response sa ating katawan by forcing yung ating pancreas to produce more insulin, we can actually sustainably help yung mga taong may diabetes by putting a what we call as pancreatic rest. Ano yung pancreatic rest? Ito yung panahon na gusto nating pagpapahingahin natin yung ating pancreas from secreting insulin. So sasabihin nila, ano na lang mangyayari kung walang insulin? Meron pa ring insulin. But what is the most important thing that we need to do is to lower our need for insulin. Kunin natin yung pangangailangan natin sa mataas na level ng insulin. And how can we do that? We just need to lower our carbohydrate intake. Kapag binabaan natin yung ating carbohydrate intake, immediately bababa rin po yung ating glucose na level sa blood. At kapag mababa na yung ating glucose level sa ating dugo, then there will be lesser need for insulin to spike. Hindi na rin magkakaroon ng mataas na pangangailangan ng insulin. Yung nangyayari kasi ngayon sa mga taong may diabetes, hindi na sila sinasabihang umiwas sa mga nakakapagpataas ng sugar. Although sinasabing iwasan nila yung mga matatamis, pero hindi sila sinasabihang iwasan yung other food na nakakapagpataas ng blood sugar na hindi matamis. Ano yung mga pagkain ito? These are what we call as starch. So yung starch ay ang complex form of carbohydrates. But kapag ito ay naproseso na sa ating katawan, pareho lang sila ng asukal, pareho lang sila ng muscovado, pareho lang sila ng honey. They are still going to be glucose and fructose na makakapag-spike ng blood sugar. Yes, meron silang fiber at yung pag-increase ng inyong blood sugar hindi ganon kabilis as compared to consuming sugar alone. But when time comes after it is fully processed, it will still have the same net effect, net burden sa katawan. Your body will still try to lower it down, and it will try to do so by forcing your pancreas to produce insulin. That's why meron tayong mga kilala na after having diabetes for so long, they eventually have pancreatic cancer. Or kung hindi man sila nagkakaroon ng diabetes because their pancreas is very efficient in producing insulin, pero it is becoming so exhausted and eventually it led into tumor formation in the pancreas. I am speaking in behalf of my family na sa mga lalaki in the family of my dad, sa kanila yung mga lalaki nagkakaroon ng frank diabetes. 4 of them already died of diabetes complications. 2 sa liver, isa sa heart attack, at saka isa ay namatay with kidney problem na nagda-dialysis na. But they also have 3 cousins na puro babae, ang papayat, hindi tumataba, but also eating the same typical very high carb diet, rice 3 times a day, lahat ng iniinom merong asukal, and kumakain parati ng snacks na saging, kamote, tinapay, banana Q, and all of those starchy foods. 3 of them less than 60 years old namatay because of pancreatic cancer. And that's why we are very, very vocal when it comes to raising the awareness of the dangers of hindi lang ng sugar, hindi lang ng asukal, kundi pati ng starch. So going back to this statement, we will move forward to their summary. So in their summary, nakita nila ng pinaka-importante dito is yung pagpapababa ng blood sugar, may it be coming from intake of medicine, and ang impact also ng pagkontrol ng blood pressure and sa ating overall cardiovascular risk. And the most important part here is the importance of lifestyle change, yung nutrition. So there is now this graph, and they already allotted a part na for lifestyle management. So noon kino-consider ang lifestyle management as alternative medicine. Ibig sabihin they considered it as parang hindi siya conventional, that when you do manage patients just according to lifestyle, parang less quality of scientific evidence yon, parang hindi siya standard. But now it is becoming the standard, it is becoming a norm, and it is now recognized that nutrition really plays a role. So with nutrition, especially for type 2 diabetics, they reviewed yung result ng American Diabetes Association, and this is the most important part. Okay? So yung ADA recommends support various health dietary approaches to achieve glycemic control. So marami, as I mentioned earlier, maraming types of food intake na nakita nila that can help diabetics. Yung isa dito would be Mediterranean, Paleolithic, which is actually still low carb. Pero yung emphasis lang dito is you eat foods that are only on Paleolithic times. So, walang modern day foods, walang mga processed foods. And the other here, low carb, high protein, meron ding vegetarian, and nut-enriched diet, yung marami sa nuts. So, looking at these results, nakita nila na very low carbohydrate versus moderate carbohydrate diet yield a greater decrease in A1C. So, mas mataas yung impact ng very low carbohydrate diet sa pagpababa ng hemoglobin A1C or yung overall long-term blood sugar control. Nagkakaroon din ito ng more weight loss, and mas limited na yung pagkangailangan ng diabetes. Use of fewer diabetes medications in individuals who are diabetics. And for those naman na hindi kayang, kasi isa sa mga important din na way to control or to improve the cardiovascular risk of those people with CVD is yung cardiovascular disease is yung low calorie diet. Yung kontian talaga, generally kontian yung pagkain regardless kung ano yung kinakain, may high carb man o ano. Pero sa mga hindi kayang mag low calorie diet, nakita na a low carbohydrate diet reduces A1C and triglycerides. So you can see here na nakita na yung pinapababa talaga is yung HbA1c and triglycerides. It doesn't mention on LDL because new studies found na LDL alone is not a determinant of heart attack. Hindi dahil mataas yung LDL mo ay mataas na yung risk mo of heart attack. You should look at other results. Kapag mataas yung LDL pero may kasamang mataas na triglycerides at mataas na HbA1c, then definitely that is dangerous. Pero if isolated LDL alone yung mataas, especially kung ito ay large density LDL, meaning hindi ito yung mga small density LDL na nakakabara ng ugat, without the increase in HbA1c, normal yung blood sugar, and yung triglycerides ay mababa, normal low triglycerides, then that is not a risk of heart attack. That is considered as not an important factor to consider. Hindi kailangang matakot. And for very low carbohydrate diet, because very low carbohydrate diet here is 20 to 50 milligrams. in our definition, 50 grams of carbohydrate in a day is already low carb, and very low carb is 20 grams or less. So a very low carbohydrate diet were effective in reducing A1C over less than 6 months, and less differences. Halos walang difference when it comes to more than 12 months. So meaning it can be sustained long term. Just like how we are doing, it's been going 4 years now, magpo 4 years na kami na hindi nagsasaing sa aming bahay. Hindi na kami nakabili ng bigas, and that's including my brother who has special needs. Meron siyang Down syndrome, meron siyang colostomy, meron siyang problems sa kanyang gastrointestinal tract na congenital, and that also includes our senior mother na ngayon ay mag 67 years old na, and we are all doing well with low carb, and the rest of our family here in Manila with my sister and my brothers Andrew and Alvin, and together with their families. And now we are so happy na pati yung mga in-laws, sila Tito Nelson, Tita Dako, Tita Grace, and Tito Luis are now embracing low carb lifestyle na din, and they are also seeing the benefits sa kanilang pangangatawan. So nakita dito na for those na join ng very low carbohydrate dietary approaches, kailangan importanteng gawin ito with professional healthcare because mangangailangan ng adjustment sa diabetes medication dose. Because kapag hindi in-adjust yung diabetes medication dose accordingly, pwedeng mag-lead into hypoglycemia. Ang pagkakaroon ng hypoglycemic episodes for those who are doing low carb is only seen sa mga either hindi gumagawa ng tama, sa mga naglo-low carb pero nag-cheat ng high carb, bigla-biglang kumakain ng sweets, and also the people who are taking medications to lower their blood sugar. But when you do low carb the right way, especially with the right knowledge and guidance kung paano tamang pababain yung pag-adjust ng mga dose medications, not just in hypoglycemic meds, but also in blood pressure medications, then you are lowering your risk of complications, yung possible side effect nito. And the most important part, you will be able to maximize the benefit. Mas maririp ninyo yung benefits of how to do it. So that's why ADA recommends individualized nutrition plan for focusing on total calorie and metabolic goals using a medical nutrition program as needed to achieve goals. So hindi na siya considered as alternative medicine. It is already part of medical nutrition therapy. And medical nutrition therapy can be different from person to person. That's why you have to know which one will work for you. So, kakain ako. It's already been 20 hours since my last food intake yesterday. Before 5 o'clock, tapos na akong kumain because we have to start our next operation yesterday. So, I only eat one meal a day. So, one meal a day, minimum of 19 hours of fasting. That is OMAD. OMAD, or 1 meal a day. So, when you do OMAD, you cannot eat the same amount of calories you usually eat when you eat 3 times a day. So that alone is already considered as low total calorie, lowered calorie intake in a day because of fasting. But your benefit will be maximized, will become even more if what you eat during that time is actually low carbohydrate. Low carbohydrate but nutrient dense. Mataas sa sustansya, mataas sa nutrition, and one of the most nutrient dense food in the world would be eggs. So 1, 2, 3, 4, 5, 6. So that's 6 eggs, and this pork at saka yung Adidas, and dalawa lang kami yung kakain yan. This is how we usually eat, and matagal na rin ako nag-pork. For the past few days, kumain ako ng beef. So this is my first pork, I think, for the week. And yun lang muna for now. If ever you like this video and you wish to know more, and if you have conditions that you think you need some health adjustment, or if you are a healthcare professional who wants to learn more, we have an LCF masterclass, low carb and fasting masterclass, para malaman natin. We learn, it is an educational platform for us to understand thoroughly how low carb nutrition can work and how it can be paired up with standard medicine, and how we can maximize the benefit of both traditional standard medicine and the nutrition part of medicine. Let food be thy medicine. just message our Facebook page rather, LCF Masterclass by yours truly. I am Dr. Rojo by profession. I am an ENT specialist and now currently training for facial plastic surgery, but I have a special interest on nutrition using low carb lifestyle and fasting for healing because I want to do surgery as my own passion, but my heart speaks for helping people heal themselves. So I no longer treat patients directly, but I educate patients kung paano nila pwedeng pagalingin yung kanilang sarili. All of these knowledge are in our LCF Masterclass, which you can already watch and be a part of our exclusive group. And for starters, you can join Life Without Tries group, already 400,000 members. Thank you so much. Maraming salamat for spreading this advocacy and letting your family members and loved ones know na pwede tayong mabuhay ng healthy without rice. And for questions, we have low carb feasting and fasting community. Thank you so much, everyone. Kakain ako. Maraming salamat. Remember to always stay low carb so that we all stay safe. Have a good day.
Every day I'm shuffling.